Hello and welcome. Today, we're diving deep into a common yet often overlooked lung disease, obstructive sleep apnea, or OSA. We'll explore what it is, why it happens, how it affects you, and what can be done about it. So, what causes this condition? OSA arises when the muscles in the back of your throat relax excessively during sleep. These muscles support the soft palate, tonsils, uvula, and tongue. When they relax, your airway narrows or even closes completely, briefly halting your breathing. Factors that increase your risk include obesity, a large neck circumference, being male, older age, family history, and certain physical characteristics like a recessed chin or enlarged tonsils and adenoids. Now, let's look at the process of obstructive sleep apnea. When your airway is blocked, your blood oxygen levels drop. Your brain senses this oxygen deprivation and briefly wakes you up to gasp for air, often without you even realizing it. This cycle of interrupted breathing and brief awakenings can happen dozens, even hundreds of times a night. This constant disruption prevents you from getting restful, restorative sleep. Moreover, the repeated drops in oxygen and surges in blood pressure strain your cardiovascular system, contributing to long-term health problems. OSA is surprisingly widespread. It's estimated to affect millions of adults and even some children worldwide, but many remain undiagnosed. Estimates suggest that a significant percentage of adults, particularly those over 40, may have some form of OSA. It's important to note that this prevalence is increasing, likely due to rising obesity rates and increased awareness of the condition. The signs and symptoms of OSA can vary, but some of the most common include loud snoring, often interrupted by pauses and gasps, daytime sleepiness, even after what seems like a full night's sleep, morning headaches, difficulty concentrating, irritability, and frequent nighttime urination. Some people also experience a dry mouth or sore throat upon waking. If you or someone you know is experiencing these symptoms, it's crucial to seek medical evaluation. Diagnosing OSA typically involves a sleep study, also known as polysomnography. This can be done either at a sleep center, where you're monitored overnight, or at home using a portable monitoring device. The study records your brain waves, eye movements, heart rate, breathing patterns, and blood oxygen levels. The data collected is then analyzed by a sleep specialist to determine the severity of your OSA. While we don't generally classify OSA into distinct types, we do categorize it by severity, typically using the Apnea-Hypopnea Index, or AHI. This index measures the number of apneas and hypopneas, episodes of reduced airflow per hour of sleep. Mild OSA is generally considered to be an A of 5 to 15, moderate OSA is 15 to 30, and severe OSA is greater than 30. The primary treatment for OSA is continuous positive airway pressure, or CPAP therapy. A CPAP machine delivers a constant stream of air through a mask, keeping your airway open during sleep. Other treatments include oral appliances that reposition your jaw, surgery to remove excess tissue in the throat or correct structural problems, and lifestyle changes like weight loss and avoiding alcohol and sedatives before bed. Management also involves addressing any underlying conditions, such as nasal congestion or allergies. While it's not always possible to completely prevent OSA, there are several steps you can take to reduce your risk. Maintaining a healthy weight, avoiding alcohol and sedatives before bed, sleeping on your side instead of your back, and quitting smoking are all helpful strategies. For children, addressing enlarged tonsils or adenoids can be a significant preventive measure. The prognosis for OSA is generally good with proper treatment. CPAP therapy and other interventions can significantly improve sleep quality, reduce daytime sleepiness, and lower the risk of long-term health complications such as heart disease, stroke, and diabetes. Recent research is focusing on developing more comfortable CPAP masks, exploring alternative therapies like hypoglossal nerve stimulation, and utilizing artificial intelligence to personalize OSA treatment plans. There are also ongoing studies investigating the genetic factors that may contribute to OSA, paving the way for more targeted prevention and treatment strategies in the future.